Joining us now is Dr. Brian Williams, who has spent decades working in public hospitals as a trauma surgeon and has seen the very real consequences of gun violence within his own state of Texas. So much so that Dr. Williams has made gun violence a cornerstone of his campaign to represent Texas' 32nd district in Congress. Welcome, Dr. Williams. I want to play you something Vice President Harris said at today's event. Watch this.
As a former courtroom prosecutor, I will tell you I have personally prosecuted homicide cases. I have seen with my own eyes what a bullet does to the human body. We cannot normalize any of this. These are not simply statistics. These are our children.
Dr. Williams, how does seeing what a bullet does to the human body affect how you think about gun safety policy?
Well, I think that's a crucial voice that is missing in Congress when we talk about gun violence prevention, is trauma surgeons like me who have been dealing with the human carnage that comes from gun violence that I've been doing for decades. This impacts individuals, it impacts families, it impacts communities. And I've just had to tell too many families about the loss of their loved ones to stand idle. So bringing a trauma surgeon like myself, I'd be the first in Congress. I would be relentless in the fight to do what we can to keep our children and our communities safe.
You know, according to Kaiser Family Foundation, firearms are the #1 cause of death for American children and teens. What will it take to change minds where you live in Texas, where there's little support for gun safety measures?
Oh, Jonathan, I would say that when I've been out talking to voters, that they are very engaged by what we can do to reduce gun violence in the state of Texas and keep our children safe. It's Republicans that have been obstructive in those efforts because they are promoting the desires of the gun lobby and not their constituents. As the previous guest mentioned, we have broad support across both parties for measures to keep our communities and our children safe. But what I would do is just bring my experience as a trauma surgeon, what I've seen, my legislative experience in Washington working on gun safety legislation, but also this is personal to me, right? I've lost family members to gun violence. So bringing that experience to Congress will be a huge benefit as we work together as Democrats to further the efforts to keep our communities safe.
You say it shouldn't take a crisis to get Republicans to the table, but we know that the gridlock in Washington is so bad. We're headed towards a potential government shutdown in a week. How do you expect to change things if elected?
Well, I fall back a lot on my experience as a veteran. I went to the Air Force Academy, and there I internalized these values that are very important about service before self and what it means to be a patriot and serve our country. And that sort of ethos, we need more of that in Congress, those of us with leadership experience and commitment to things bigger than ourselves. And gun violence is a classic example of this. It is a public health crisis, the leading cause of death for children, more than 500 mass shootings this year. 1 in 5 Americans have been directly impacted by gun violence. This is something that should be a no-brainer. Congress comes together during a time of crisis to take care of its citizens, and that is not happening. So I would bring that sort of courageous leadership to Congress, join other Democrats, and further the work that I've already been doing for decades.